This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. It is Mon Health Talk, and once a month we turn the spotlight on the Monongalia County Health Department. And this morning we're going to be talking about Monongalia County Health Department dentistry online, a couple of other dental-related subjects to get into. Yes, trick or treat is coming up. That's when you got to be careful because, sugar. And sugar's bad for teeth or something like that, they tell me. Joining me in studio this morning, we've got Tiffany Summerlin. Tiffany, good morning.
Good morning. Thanks for having me.
And Dr. Kayla Courtney. Kayla, good morning.
Good morning. How are you doing?
And Mary Wade's over there as well. Mary Wade, say good morning.
Good morning.
All right. Thank you, Mary. Appreciate it. Well, guys, thanks for coming in. If you listen to Mon Health Talk, you know that before we dive into the subjects, the guests must talk about themselves at least for a minute or two. So, Tiffany, just tell us a little bit about your background and how you're involved in all this.
Yeah, thank you so much. So at the Monongalia County Health Department, I'm a public health dental hygienist, and I coordinate Smile Express. It's our mobile dental program, and I've actually been at the health department for about 10 years, and I've seen it grow and change and evolve over that time, and just really excited to be a part of the team there.
And Dr. Kayla?
Yeah, so I am a general dentist at the Monongalia County Health Department, and, I treat patients of all ages, and we really take pride in our patient care there and really love our patients and our patient base.
Well, guys, thanks for coming in this morning. Dr. Kayla, I'll kick this question to you to start with. Can you just give us an overall idea when it comes to dentistry, what's available through the Monongalia County Health Department?
Sure. So we provide, your run-of-the-mill dental services like dental cleanings. We do an exam with every patient, including an oral cancer screening. We also do Invisalign. We also do same-day crowns, restorative treatments. We also provide, more innovative treatments such as Botox. We can do cosmetic and therapeutic treatments for that. And we also do fillers.
You're a dentist office, right?
That's right, yeah.
Anything you can find in any other dental practice, you're going to find through the health department. Yeah,
definitely. A lot of people don't really know that. And so we see patients of all ages. We take all types of insurances, including Medicaid. And so we can pretty much do anything other than the things we need to refer to specialists for, such as extractions and root canals. But anything else, we're your people.
Tiffany, what kind of patients do you see on a regular basis?
Well, just like Dr. Courtney said, we see patients of all ages, all socioeconomic statuses, all insurances. And, one thing I definitely wanted to highlight during this time is if somebody has Medicaid and they are an adult, changes just happened with Medicaid coverage. So an adult with Medicaid has $2,000 worth of benefits over a 2-year period. And it's amazing to me the number of adults that I come across in seeing their kids. They don't realize that because they have Medicaid, they can come to our office or any other provider who accepts Medicaid and have comprehensive dental care provided for them. So that's definitely something I wanted to make sure that people are aware of.
Dr. Kayla, how often do you see these? She mentions the adults. How often do you see the adults that go, well, yeah, I make sure the kids get there every 6 months? When's the last time you've been to the dentist? What is the answer to that question?
It's more frequent than you would think because people are more inclined to, take care of their kids and kind of put themselves on the back burner. But I really encourage people to do both, make sure your kids are getting the quality dental care that they need, as well as, taking care of yourself, because, we truly see a lot of people that are just kind of think that dental care is something that they can kind of put behind them and only focus on certain needs or when something hurts. And I really urge people to, get their routine dental exams and come see us frequently so we can take care of you.
All right, let's say you're an adult, and maybe it's been a little bit longer than 6 months since you've been to the dentist. What's a typical exam going to be like when you come in, if it's been a while?
Yeah, so if it's been a while, typically we'll take bite wings, so that's x-rays of your teeth, so we can check for cavities. And I will take a look at all of those, make sure everything looks good. When I go into the room, I usually ask patients, is anything bothering you? Is anything hurting you? And then we go from there. If nothing's bothering them, then I'll go through. I do an oral facial exam, which includes I check their TMJ, see if they have any clicking, popping. Then we go inside the mouth, and I work from outside in. So I take a look at all of the tissues. I take a look at the teeth. I take a look at the tongue, as well as an oral cancer screening. So it's really a comprehensive dental treatment and dental visit.
What's TMJ?
Temporomandibular joint disorder.
Okay. Easy for you to say.
Yeah, I say it a lot in a day.
So what is that?
So that is a disorder with your jaw joint, pretty much. So if do you ever have like clicking and popping with your jaw?
Not that I'm aware of.
Okay, well, that's good. A lot of people do. And so clicking and popping with your jaw, we say, is like the beginning stages of a TMJ issue. So some people can have their jaw lock open. They can have it lock closed. They can have pain frequently. It's really a comprehensive and complex disorder. When we see complex cases with TMJ, we usually refer to an oral surgeon, but we can also provide care such as splints, and Botox is also an option for TMJ. So those are the treatments that we can provide for that as well.
We're talking about the Monongalia County Health Department dentistry services this morning. We're going to talk about Smile Express and some Halloween tips as well before we get to the top of the hour. But we've got to squeeze in our first break this morning. Our guests, Tiffany Summerlin and Dr. Kayla Courtney, joining me in studio this morning. We will continue our conversation in a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Tiffany Summerlin, joining me in studio along with Dr. Kayla Courtney. Tiffany, can you tell me, what is Smiles Express?
Yeah, so Smile Express is a mobile dental clinic and program that started in 2018. And the sole purpose of that program is to be able to provide dental services to individuals who do not have traditional access to care.
Is that, how much of an issue is that, especially here in Monongalia County? We think we're Morgantown, one of the more urban, I use that term very loosely, in West Virginia areas. But when you think how big the county is, there's still a lot of rural area in the county.
Absolutely. And quite honestly, we also go to 4 counties. So we go to Wetzel, Marion, and Harrison, and Monongalia for our school-based program. But we also serve individuals who are in substance use recovery centers. So the fact that there is a large number of dental providers in Mon County doesn't necessarily provide opportunities for some individuals to drive to a clinic, go into the clinic, pay for services, and be able to set up a new appointment in 6 months. So we've been able to kind of bridge that gap for some individuals who just don't have the ability to do that. And a lot of times that's kids.
Yeah, and you kind of answered my next question through that one. What's the advantage of going to not just children, but individuals out in different parts of the region?
Well, as we know in our area, sometimes transportation is a huge challenge for the people here. And so I'm able to go to an area that's maybe closer to them, and maybe a place that they've already gathered for an event. We will kind of tag along with that event, and we're in a lot of different places, serving a lot of different people in a lot of different situations. And so we try to go to the places that we can see the most individuals and be able to just provide them an opportunity to have a healthier oral health condition.
You talked about working with the recovery centers. Why is that important? Why get involved with that venture as well?
Well, it was something that started with the Smile Express program in the spring of 2023. And It was actually, there was an individual at one of the recovery centers that reached out to us to ask if we could come and see their clients. And quite honestly, it's something I hadn't even really thought about. But as you could imagine, a lot of individuals who have substance use disorder maybe have neglected their oral health, and they are constantly reminded of the fact that, you know, they were using, they're trying to stay sober, they are trying to start a new life, but every time they look in the mirror, that same thing is there to remind them of, you know, their previous life. And so it is an amazing opportunity to impact the lives of those individuals, to possibly provide a way for them to, you know, stay sober and get a job, connect with family, not be judged. So there are so many layers to the ability to do this.
By going to those patients, does that help get over the hump of maybe just the embarrassment of calling the dentist, or coming to you guys rather you guys go to them?
Absolutely. And that's something we hear a lot. You know, it's like, oh, I don't want you to look in my mouth. I'm embarrassed or I'm ashamed. And, you know, and that's something that we at the health department, at MCHD Dentistry, and with Smile Express, there is absolutely no judgment that happens with any patient. So if you have avoided dental care due to phobia, maybe you had a bad experience as a child, dental care elicits so many strong emotions and so many reactions from patients as the reason why they have avoided it. And, you know, for me personally, as a dental hygienist, I've made it my mission to not get in the way of somebody to be able to pursue a better oral health condition.
Dr. Kayla, let me come back to you. When we're talking about kids, how much is that a factor as well? Not just, I mean, obviously you want to have good oral health, but for kids to have good teeth, good smile, that impacts you in a lot of different ways especially when you get into those teenage years.
For sure. And so I see a lot of kids that, you know, as they get older, they have said, oh, I had a bad experience when I was a child at the dentist, and I'm anxious, and I don't want that to happen again. And going to the dentist from an early age, we typically recommend, you know, within the first year of life, or by the time you have your first tooth erupt in your mouth, that parents get you to the dentist, just so we can have that exposure of kids getting familiar with sitting in the chair, kids getting familiar with the dentist, and being more comfortable with that atmosphere, rather than, you know, their first visit is at 6 years old and they have 3 cavities, and now we have to fill them. And it's a traumatic experience for not only the kid, but for the parents as well, because parents don't want to see their kids in that situation and crying. And as they get older, you know, those can really impact kids and affect their oral health as well, because if kids have a bad experience at the dentist, they're less inclined to take care of their teeth as they get older, because they don't want to come back to see us.
I just wanted to emphasize something that Dr. Courtney said about the first visit. It's really critical that we see kids around their first birthday. And quite honestly, it's not necessarily for the kids themselves. It's to talk to the parents, set the parents up for success in caring for their child's teeth. With the Smile Express program, when we go out to these schools and we see kids that maybe have never seen a dentist, I've seen seniors in high school that have never been to the dentist before. It is, quite honestly, we can change the direction of a child's life by identifying problems. If children are in pain and that's all they know, they have chronic exposure to pain, they're not sleeping, they're not eating, they're not behaving. Maybe they got misdiagnosed with ADHD. You know, maybe they have airway issues. There are many things that we can do in that dental chair to really have a positive impact on that child's life.
I got one random dental question before we go to the break. When you ask me if I've been flossing regularly, do you know if I'm lying?
Yes.
I'll second that.
Shoot. All right, our guest this morning is Dr. Kayla Courtney and Tiffany Summerlin, and apparently they know you're lying. We'll continue the conversation on the other side of this break. We're back in a moment. This is Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest in studio this morning from the Monongalia County Health Department Dentistry. I got Dr. Kayla Courtney and Tiffany Summerlin joining me in studio. Just so you know, we have confirmed the do you floss regularly is a trick question. By the way, why do you ask me questions? Well, not you personally, but I'm sitting there, you've got things, instruments in my mouth, and you're like, so, what do you do for a living? How do I answer those questions?
I think it's mostly because we just like to talk.
Oh, okay. I try to answer them. Ha 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 ha. Yeah.
It's amazing how much we can't understand, though.
It is, really.
Yes,
oh, you work at the radio station. Oh, okay, got it. I digress. All right, Halloween is coming up this week, and Monongalia County Health Department is getting into the spirit of the season.
Yes,
so
we are.
What's going on, guys?
So we are having our first trunk or treat event. That is tomorrow, October 29th, from 5:30 to 7:30 p.m. We hope, a lot of people have said that they're going to participate and decorate their trunks. So we hope to see a lot of people out.
And where will that be?
It'll be at the health department. Okay. Yes.
So does Halloween make dentists cringe? Because that's all the stuff you warn, sugary, sticky, caramel apples, hard candy. It's all the things you preach against, isn't it?
It is, but, dentists are people too. We also love candy. And so who am I to tell the kids they can't have any candy? Everything is good in moderation. Typically, if kids are going to be having a lot of candy or adults, we recommend to stay away from really sticky, gummy type candies, caramels, especially for adults. I think Milk Duds and Jolly Ranchers will take off crowns better than anything that we can ever use.
Yes.
Oh, wow. All right. Put that on the list of things to watch out for. Do you see, I mean, serious question though, do you see candy-related injuries, issues this time of year? Typically,
yes. Just because the frequency that you're eating candy goes up this time of year. But really, it's so common that someone will come in with a crown off and say, I was eating a Jolly Rancher, or I was eating a Milk Dud. So my advice, if you have kids that are going to be eating a lot of candy around this time of year, especially this week, sticky candies like gummies, gummy bears, they stay on the teeth longer than chocolate. Chocolate, especially dark chocolate, is better for your teeth. So this is an instance where I would tell everybody to just eat more chocolate.
You heard it here on Mon Health Talk. Eat more chocolate. I mean, who am I to argue with the doctor's opinion?
That's right.
That's right.
Any other safety tips or tips just for Halloween?
Yeah, so concerning candy, I have kids, they're in their 20s now, but I remember the day after Halloween, we would have 2 buckets of candy sitting around. And quite honestly, the best thing to do is let your kids eat a lot of candy at once. I know it's horrible for their stomach, but maybe it might make them a little less inclined to eat candy later. The worst thing that you can do is kind of dole it out, on a regular basis, because you are increasing the frequency of that sugar and that acid in their mouth. And so, something that I always tell patients, you want to reduce the time that offensive thing is in the mouth. So you want to, it's better to guzzle soda than it is to sip on it throughout the day. It's better to sit down and eat your 5 pieces of candy at once rather than eating a piece every hour. So just the way that you eat them can make a really big difference.
I think Halloween's the perfect time to teach about taxes and candy taxes. I think it's the perfect time.
Mm-hmm. Making sure it's safe. You have to sample it.
50% of this has to go over here. Let me teach you about that. That's a funny point you bring up because I've heard that before. Actually, my dentist told me I'm a sweet tea drinker. Loved my sweet tea.
Ooh,
Drink it all at once. Don't sip it through the day.
Yeah, absolutely.
Because it's just constant sugar in your mouth.
Mm-hmm. And sugar feeds the bacteria that create acid, that create holes in your teeth. So it's a very simple chemical reaction that happens in your mouth. So you want to limit the food for that bacteria to create holes in your teeth.
Yeah. You notice I'm sipping water over here.
Nice.
I'll guzzle the sweet tea a little bit later on this afternoon. Guys, got about 30 seconds here. What do you want folks to take away from today's show?
Just that, especially regarding Halloween, avoid sticky, sour candies, eat more chocolate. But also, dentistry is part of healthcare, and we really take a lot of pride in helping people better their oral health. And, don't be so afraid of the dentists. We're not terrible.
Dr. Kayla Courtney and Tiffany Summerlin. Guys, thanks so much for coming in. Appreciate it. Enjoy the conversation. Happy Halloween.
Thank you.
Thanks.